Yes.
Beautiful. All right, Dr. Raggio-Ashley, take it away.
All right. Good evening, everyone. Let's see. Okay, wonderful. So we're going to be talking about COVID-19 vaccines tonight. And I think I'm hearing some feedback. If someone could mute, thank you. So at any rate, so one of the things I was asked to talk about was how did vaccines begin? And actually, at least the vaccines, the way we do them nowadays, we go to 1796, and an English doctor named Edward Jenner, he noticed that milkmaids, when they would get smallpox, be exposed to smallpox, they didn't get smallpox. And what he realized was that in their hands and their fingers, they had little cuts. And so cowpox, which is a mild disease, would get into their bloodstream. They would develop antibodies, fighter cells. And then when they saw the smallpox, that was a similar disease, they had protection. Next. Next slide. So I'm going to take off my mask, and I had it on because even though I'm vaccinated, if I was with you in person, I don't know all of you. I don't know if you're vaccinated. So I'm trying to protect me, and I'm trying to protect you. So before we talk about COVID-19 vaccine, let's talk about COVID just for a moment. So COVID-19, when you break down the word, it's important for us to understand, right? The CO stands for corona or crown. Those spikes you see, corona. And then the VI stands for virus, and the D for disease. It is a new or novel coronavirus, which was first identified in Wuhan, China in December 2019, and that's why we have the 19. But coronavirus is not new, okay? It's part of a family of viruses, but there are many different types. There's human virus, there's animal virus. Most of the human viruses cause mild upper respiratory illnesses, the common cold, but some can cause, as we know, severe disease and death. Sometimes, but not usually, the animal coronaviruses can infect humans. And that's what appeared to have happened with COVID-19. And as with two earlier coronaviruses, MERS-CoV and severe acute respiratory syndrome, or SARS-CoV, we have SARS-CoV-2 or COVID-19. There are many new mutations. You've probably heard the most recent one is Lambda. We have Delta, UK, Brazil, South Africa, and California. Next. So what does COVID-19 do to our bodies? Well, it causes, when we have symptoms, it causes a diffuse inflammatory response. But the thing is, many people are totally asymptomatic, and that's how the virus spreads. So it can range from mild to severe illness, with symptoms appearing 2 to 14 days after exposure, with sore throat, runny nose, congestion, cough, nausea, vomiting, diarrhea, fever, chills. People get sicker, shortness of breath, fatigue, body aches. Sometimes people get a new loss of taste or smell. As I said, most people have very mild symptoms, particularly children. And children are the main transmitters of this. And in fact, that's why they were working on the vaccine for so many years, because their parents were missing work and they wanted to vaccinate the children to protect them, but also for their parents not to lose so much work. Unfortunately, there are some children that can get very severe disease called multi-system inflammatory syndrome. They're mostly African-American and Latinx children. COVID-19, as we know, can cause severe illness and even death. We've unfortunately just recognized the 4 million people who have died from this disease. We're starting to see this illness in much younger people. And those younger people who are getting this severely and dying are unvaccinated. Many people with underlying medical conditions, diabetes, cardiovascular disease, chronic obstructive pulmonary disease, asthma, sickle cell, obesity, Also, certain groups of individuals, African Americans, Latinx, Native Americans, Alaskan Natives, are at increased risk of severe disease and death. There's something though else that I want to make sure people know. Many people survive the hospitalization to go home and die. And why does that happen? Sometimes they develop a clot, an embolism, okay, in their lungs, in their legs. They get a heart attack or they get symptoms of a heart attack and they don't seek help. So we say to people, if you go home and you feel sick, get checked again. It's very important. There's also what are called long haulers, some people who have long-term symptoms, including extreme fatigue, depression, some people who have to use oxygen for prolonged periods of time, and it can take more than a minute to get your smell and taste back. Next, please. Okay, so we're going to talk about the vaccines, and the lovely young lady in the corner you probably all know is Dr. Kismakaya Corbett. And I just want to thank her. If she was here, I would just like clap and jump and everything else. She is a scientist who is at the National Institute of Allergy and Immunology and Diseases. And it's important to know that she started there as a young student. Okay. And I think the issue of mentoring is very important to bring up. So she led the team that discovered the Moderna vaccine. And the Moderna vaccine is very similar to the Pfizer BioNTech vaccine that was also developed by another group. They are both messenger RNA vaccines. What is messenger RNA? It is a protein. And you've probably heard over and over again how these vaccines have to be kept very cold. That's because when they get into your body, they literally disintegrate from the heat. And what your body does just before that disintegration is to develop antibodies or fighter cells so that when they see COVID-19, they protect you. One of the wonderful things that just happened is we just got FDA emergency use authorization for adolescents in May. And this was for the Pfizer vaccine. My understanding is Moderna has applied for this. And many of you have probably heard today that Pfizer has applied for emergency use authorization to give a booster or third dose. I want to thank Reverend Nurse for reminding me of this just before we got on the call. And these vaccines are given in 2 doses, okay? What happens is you get the first dose, 2 weeks later, you have some protection. You get the second dose. 2 weeks after that, you have full protection. Johnson & Johnson is a slightly different vaccine. It is called a vector vaccine, and that is a 1-dose vaccine, and you have full protection 2 weeks after that 1 dose. Now, I said full protection. I need to correct myself. No vaccine gives you 100% protection. Sometimes you get what's called breakthrough. Small number of people get infected, but when they do get infected, they usually get very mild disease and you usually don't see any deaths, as in the case of the Yankees. You saw they got the J&J, they got infected, they didn't get hospitalized, they didn't die. There is another type of vaccine. It is called a protein subunit. Novavax is that vaccine. It's not approved in the US yet. So I already talked about the effectivity of the vaccines. One of the things that make these vaccines very safe is people were in trials. You're going to hear from Reverend Dr. Nurse about her experience in the trials. It's important to know that these trials included African Americans, Latinx, Native Americans, whites, people from all over the world, okay? And when you get FDA emergency use authorization, it helps to make the vaccine safer because you get ongoing monitoring. Next. Okay, so some key things to know about the COVID-19 vaccine. Everybody 12 years of age and older, it is now recommended that you get the vaccine. We are currently conducting clinical trials on children down to 6 months of age. Get your COVID-19 vaccine as soon as you can. Widespread vaccination is a critical tool to help stop the pandemic. You hear us say things like we want to get 70% of the people vaccinated. What we need to say is we want to get at least 70% vaccinated, because when you vaccinate a large group of people like that, it helps to stop the spread. Vaccines, COVID-19 vaccines are safe and effective, and they are free. Nobody should charge you. You may have side effects after the vaccination. I had Pfizer. My 90-year-old mother had Pfizer. My husband had Pfizer. I wanted to get Moderna, but they didn't have Moderna. They had Pfizer that day. And the first time I didn't get any reaction. My second time, I just had almost like mild flu, you know, a headache, you know, some muscle aches for a day. My mother, my 90-year-old mother, she breezed through it, nothing, okay? So that's basically it. You may get some redness, swelling at the site, okay? I've already talked about how long it takes to get immunity to the vaccine. It's important to understand that it is not until you've gotten your second dose of the Moderna and Pfizer 2 weeks after that you have the maximum protection, which is about 94% against getting COVID-19. Johnson & Johnson, that's 2 weeks after the one dose, because it's a one-dose vaccine. And the amount of protection against getting infections a little bit lower, but all three are equally effective in terms of preventing severe disease and death. When you're fully vaccinated, you can do a whole lot of things. But what did I say earlier? If you don't know if other people are vaccinated, wear the mask. Okay, next. We're almost done. Thank you. So some vaccine 19 truths and benefits are, this vaccine was not made at warp speed, okay? It was made over many years by many scientists like Dr. Kismakaya Corbett, who you're gonna hear more about from Reverend Nurse. And let me tell you, she may be a young woman, but she was working on that vaccine for years. COVID-19 vaccine prevents you from getting COVID-19. It doesn't give you COVID-19. COVID-19 vaccine prevents you from getting severely ill and dying from COVID-19. Most people getting severely ill now and hospitalized are unvaccinated, and many have the Delta variant. Pfizer vaccine, we know, provides some protection to the Delta variant. We believe Moderna does as well, and Johnson & Johnson, but we know that Pfizer does a lot, and that's why they're asking for a third vaccine to give you a boost. COVID-19 vaccine does not change your DNA. COVID-19 vaccine cannot prevent you from becoming pregnant. It doesn't make you sterile if you're a guy. COVID-19 vaccine appears to be safe for women planning to get pregnant during pregnancy and afterwards. I can't tell you, and it breaks my heart, how many pregnant women come in looking healthy, suddenly crash, okay? And when I say they crash, some of them die, and their babies are very ill because they're not vaccinated. Please, people need to be vaccinated. Also, if you've had COVID-19 infection, you can get vaccinated. You have to wait about a month, sometimes a little bit longer if you're sicker. Next, and let's see, next slide. Thank you. Okay. Oh, can you go back? Please forgive me. Just go back one. There you go. There you go. Okay. So some people, like myself, I carry an EpiPen, have severe allergic reactions, and I'm asked, should I get the vaccine? Most people, the allergies you have, food allergies, drug allergies, those are not contraindications to getting the vaccine. But when you get the vaccine, there's always the nurse or the doctor always has epinephrine in case you have a reaction. There are some people that may be allergic to ingredients like something called polysorbate in one of the vaccines. So just let people know if you have a history of reactions. Next. Okay, so real quick, there's some great resources. We can do this at vaccine.gov, and you can find a COVID-19 vaccine near you. We've got some health department people that are gonna give you some more specific information about Fairfax. Next. And, oh, back one. It looks similar, but it was in Spanish. So, juntos si podemos, okay? We are a multicultural community. Go to vacunas.gov. encuentre vacunas contra el COVID-19 cerca de usted. Okay, next. And this is just another nice community toolkit. I happen to be a minister, not a reverend nurse, and married to a pastor. So I like this toolkit and I use it. Thank you. I just realized we're all ladies. Thank you very much, and I'm done.
Fantastic. Thank you so much, Dr. Raggio-Ashley. I definitely learned a number of things in that presentation. Thank you. That was so great. So now we'll turn it over to Reverend Gloria Nurse.
Okay. One, I'd like to say thank you for coming out. I know many of you have very, very busy schedules, but I'm glad you're taking the opportunity to learn and relearn so much about this virus. How this virus started out is not the way it's going to end. And losing as many people as we have in America during the last year and a half, 2 years, I don't think there's ever been any virus or any disease that has ripped through America the way this one has. And so some things need to be heard over and over again, and so that it can infiltrate your mind and cause you to act on it. I'd like to tell you a little bit about me. I'm a woman who came from New York City. I was born and raised there. And before I tell you about the Moderna trial, I think it's important for you to know a bit about who I am in terms of my health aspect, because I was a very sickly child. By the time I got into the 4th grade, I missed a whole school year in the 4th grade. And that's where a number of things began. I was actually born with asthma. My grandfather, my mother had asthma, and as a result, we traced back, I was in a trial at NIH, and we traced back my asthma to my 3rd or 4th great-great-great-grandmother. And as a result, mine is an inherited asthma. It's not an asthma that's from the environment at all, although the environment does affect it. And so this was a problem throughout my childhood and affected my going to school, being involved with other children. And at times it was very isolating and very lonely. And I can honestly tell you that I decided when I heard about the vaccine that I wanted to be a part of it. I didn't know exactly what I needed to do, but I knew it was something that I was interested in because I understood that I had tuberculosis as a child, that my lungs were not going to make it through this COVID-19 if I did not do something actively to respond to keep myself alive. And I wanted to be alive to do various things. Whether it's to go out to dinner or whether it's to just simply walk and see the beauty of nature, I wanted to live a full life. And even as a child, I made sure to fight to live. And so I was going to do that. And I'm giving you this background so that you can understand why it was important for me to be a part of a trial test. I actually called NIH, wrote NIH, because I found out that Kizzy McCormick was the African-American woman who had invented the, not the disease, but the antibody to the disease. And I called a number of institutions. And then one of the things that happened was at that time, there was all the universities of the historically Black colleges got together, and there was an article in the newspaper talking about they were looking not only for Black people in the trials, but it was also safe to be a part of the trial because, one, that there were Black people who were doctors and who were at the helm of these institutions that were giving the trial. So that really gave me a sense of safety to know that there were going to be people who acted like me, looked like me, and understood the dynamics of what we could go through as a people. And so one day while visiting my doctor, my lung doctor, I told them that I'd been having a problem getting into some of the trials. And I thought that they needed me. They were looking for Black people. And here I am, Black as I want to be. And I wanted to be a part of it. So I thought that I should get in. And he laughed and he told me, Gloria, I'm going to do something. And he went out of the room and he came back about 10 minutes later. And when he came back, he told me, Gloria, I want you to know, my doctor was Hispanic. I have been a part of this trial. My brother has been a part of this trial. And standing before you is the man who's the head of the trial. And I was like, what? And so I was so excited. And so immediately my doctor's visit was finished. I was supposed to be getting a flu shot. I ended up getting a shot for the Moderna virus vaccine. And lo and behold, when I came home and told my family, I had talked to my family about this, by the way, even before I went to the doctor. And so when I came home and told my family what had happened, they couldn't believe it. And I went on and I got the first vaccine, and that first vaccine did really nothing to me. And I have a very good friend by the name of Reverend Breland, and she told me straight away that, oh, you got the vaccine. You got the vaccine. I know you got the vaccine. And I'm like, well, how do you know? And because in the trial, they don't tell you whether you're getting a placebo, meaning that you don't know what it is and it's innocuous, it's not going to do anything, or whether you're getting the vaccine. The doctors don't even know. So when I left there, I felt fine. I came home. I had to sit down for a second to realize, oh my God, I got the vaccine. And I was honestly so excited. I went to bed that night. Nothing happened. I woke up 3 weeks later. I went to get my second vaccine shot. And I thought I was going to walk out of there in the same condition. Well, by the time I got home, 2 hours later, I felt a fever coming on. And when I felt the fever, I was like, okay, Gloria, sit down. Then I felt a little bit of pain in my arm. And I thought, okay, let me make a phone call. I live by myself. If I'm found dead in the morning, I need somebody to declare I'm dead. And so, and not to sit here and smell the house. And so I called my brother's doctor and I told him, I said, listen, I just got the second vaccine. I'm not feeling well and I'm going to bed. And before I could get to bed, I had a fever of 101, which shot up later on in the night to about 102. And anyway, in the night, I got all these pains, I got all these aches, and I'd never had the flu before, but I had been told what the flu felt back, that there were a lot of aches and everything. I had aches in my toes, I had aches everywhere. But by the time I woke up in the morning, all the aches were gone. My brother woke me up at 6 o'clock in the morning to see if I was still alive. Fortunately, I was. I don't know how happy he was that I was alive, but the fact remains is that not only was I alive, but I did not feel good. I could feel the results of that vaccine. And as the doctor before me, Dr. Tanya, said, how her mother whizzed through it at 90. Well, I'd like to say I whizzed through my second shot, but I did not. But after 2 or 3 days, I had no appetite. I just was lethargic and full of fatigue. And honestly, food did not interest me. It took me a while to get back on the food track. And but after that, after a full week, I would say I was back to myself. And I really am very thankful, one, to God that I did get that shot. And then there was one last thing I want to say. I know that a lot of people have not gotten the vaccine for a number of reasons. Part of my tradition as a minister is that at every sermon you get an altar call. And I'd like to give an altar call to somebody tonight. What I want to tell you is that there's a choice that you have. God does not force us to do things. The choice is you have the choice to get that needle, to get that vaccine. It not only protects you, but it protects your family. It protects the country. It protects the world. And above all, it protects yourself. You are God's gift. And the fact that you're God's gift means that you've got something to give others. It's not that you were just created in a vacuum. So I want you to know, like any good preacher who's going to preach, he or she is going to remind you that choice is yours to make. The time for salvation in terms of getting a vaccine is not tomorrow, but now. And I leave you on that thought.
Thank you so much, Reverend Nurse.
You're welcome.
So now we have a quick video that is from Dr. Osborne Wu from Neighborhood Health. Just give me 1 second while I pull that up.
Good evening. My name is Dr. Osborne Wu, and I am a family medicine physician at Neighborhood Health, as well as the Associate Medical Director here. I've been providing medical care for almost a decade, and in that time, I've really come to appreciate prevention as part of important medical care. And so the COVID-19 vaccine is one really important tool for preventing COVID-19. And some more information about the vaccine in particular, more information about COVID-19 in particular, is that it is still here, it is still prevalent, and it is affecting our children. So 1 in 10 children are currently among the case numbers for COVID-19 in this country. And additionally, about 10% of children end up with some type of a disability or hospitalization from COVID-19. It is among the top 10 causes of death in children, unfortunately. And we want to be able to prevent this. It's really important. So some other reasons why you want to consider getting the COVID vaccine for you and your child. Well, first, I understand that when you're young and healthy, it can be hard to think about getting a vaccine and preventing disease. But in truth, if you got COVID-19, you might not end up in the hospital, but you might end up with something called morbidity, and that's when you have long-term consequences to a disease that may not turn up in reports or may not turn up in hospitalizations or data numbers, but it does affect you. And so even though you're young and healthy, you're still at risk for getting those complications from COVID-19, such as long-term breathing problems, mood disorders, maybe problems walking, different pain complaints. And so to avoid that, one of the best ways to avoid it is by getting the COVID-19 vaccine. Also, one of the other things to consider is that even though you might be young and healthy, your grandparent or somebody who's immunocompromised might not be. And even if they get the vaccine, it might not work quite as well in them because their immune system is weaker. And so to protect them, you want to get the vaccine yourself, so that way you don't risk transmitting the COVID-19 virus to them and your loved ones. Another thing to consider is, some people worry, oh, well, what about the vaccine being safe? In truth, this vaccine is one of the safest and most efficacious vaccines we've had in U.S. history. This was an unprecedented time when we had governments from all over the world collaborating to make this vaccine happen. And so because of that, we have really robust data, lots of really good information and studies showing that this vaccine is safe, very, very safe, and very, very effective. They did include children in their studies. They had children from ages 12 and up, and that is how it got to be approved for that age group. So with that in mind, The truth is that, it's safe, it's efficacious, it's going to prevent your loved ones from getting sick, even if you're young and healthy. But then, even so, it'll keep you from getting some of those long term consequences from COVID-19. And so, with all that in mind, I really encourage you all to get the COVID-19 vaccine, both as prevention and just to better the society and be a part of the community that's really striving to make this pandemic end. So, thank you, and I wish you all the best.
Thank you, Dr. Osborne Wu. Although
that face, that
sorry about that ad playing after that video. But thank you, Dr. Osborne Wu. Although she couldn't be here with us today, that information was definitely very valuable. So with that, thank you so much for our panelists for presenting with those three presentations. Sorry, I just hear a little bit of feedback. Sorry about that. We have reached our Q&A portion of our session today. So with that, I know no chats came through that I could see with questions. But does anyone want to either pop something in the chat or come off mute to ask our panelists any questions about the COVID-19 vaccine?
Hi, Nicole. My name is Nikki. How are you? So I do outreach. I'm sorry, I have to clear my throat. I do outreach for the health department in Fairfax County. And most of my outreach is focused in our African American communities here. And one thing that I've noticed is that at the beginning of the pandemic, it truly was an issue of access to the vaccine. And I think it still is an issue of access, but even more so what I'm seeing with this last segment of our Black community that is not getting the vaccine, I'm seeing a lot more hesitancy more than ever. And I'm noticing that it is not, it's very complex. In the beginning, everyone was talking about Tuskegee and hyper experimentation on Black bodies. But, I hear that, but I don't hear that a lot. I don't hear that complaint a lot in our younger generation. I'm hearing a lot of, I just don't trust the government. This is population control right here. I'm also hearing people who are, I'm healthy. I can manage my health. I'm drinking sea moss now, and I'm drinking lemon water. I'm hearing people who just, the vaccine is not a priority right now. For a variety of reasons. They have to work, there's a lot of other things going on. So if it's not convenient, it's not here. I don't go to the doctors ever. I'm not about to go to the clinic or CVS now to get a vaccine. So there's a lot of different things that I'm seeing in the community, a lot of hesitancy that I'm seeing. And one thing that I can say is that I feel that with the complexity of all that I'm hearing, I feel that it's all rooted in mistrust. And so I would say that for me, what's been hard for me lately in this moment is just finding a way to really reach our younger Black audiences and just really, that is I would say the issue of the hour right now. It's how do we make this vaccine something that is a priority in our younger Black adults. And I've been going to barbershops, I'm talking to a lot more younger people, and I see people are they've either already gotten the vaccine or they're just, no, they're not feeling the vaccine. I'm not really seeing a lot of in between. So I would say that is a really big challenge right now. So, and I don't know if anybody else on the line, you know, if you've gotten a vaccine or if you haven't gotten a vaccine, but if you are hearing this in your circles or, you know, are feeling the same way. And I get it too. I understand it too.
So, if I may, I'm really glad you shared that. And it's Nikki, right? Because I see Nakia, but you like to be called Nikki.
Oh,
right?
yes, Nakia
Okay,
is my real name.
Okay, Nikki.
Everyone calls me Nikki.
So now I'm just gonna self-disclose. I'm 65 years young, okay? And I say that because you know, this is what I see with young people. Like this is their phone. We're all here, and it's like, and they're talking to each other on their phone, right? And I say that because I think that we have to do two things. One is, believe it or not, it's like 10 or 12 people who are anti-vaxxers who have flooded social media with misinformation, okay? And I think if our young people knew who those people were and what they stand for, they would be amazed. That's number one. Number two is, I think we have to make it, yes, we want our young people to be vaccinated to be healthy, but I really think we have to make it cool to be vaccinated. I think we have to find the coolest people on the block. We have to, and I joke, I'm dead serious. We have to find the rappers and whatnot that they like, get them to do some kind of rap about, you know, vaccinated, and I got vaccinated and you got vaccinated, and what, you know, however they want to rap or talk with each other. I really do. And guess what else? I think at the other end of the spectrum, I think young people listen to old people. Mm-hmm. Okay. So I think on the other end, if they see mama such and such, if they see grandma such and such, and that they got vaccinated, they can be like, now wait a minute, she's 90. You know, even though they don't think about the future, they're gonna be like, she's 90? She got the vaccine? Right. Does she know something? But I say that to you, and it's gotta be something like that, or people that they trust and have faith in who've gotten the vaccine. And you know, it's so funny. I wish Dr. Debbie was here, because I think she's the one that talks about you know, like many touches, okay? Then it may take 20 touches, and you know, we're talking about young people now, and you know, it's so funny. I was with some folks today, and I said, oh, can I talk about like touching adolescents? Because you know, you don't want to come across kind of weird, but what we mean by touches is, you know, communicating, as you said. It might take you going to that barbershop 10 times to get one person to get vaccinated. And I want to encourage you, because I can't imagine how you feel, because it's like what you're selling is health. You're selling. and you have to, and all I can say is that, and I think whether you go to the barbershop or the hairdresser, the nail salon, the other thing is, if there are people there who are cutting hair, you know, who are doing the nails and whatever, and they get vaccinated, just think about it. You're sitting there getting your nails done, as my nails look horrible. You're sitting there getting your nails done, and you're in front of somebody for however long. You're getting your hair cut. You know, you're you know, blowing the breeze or whatever. But anyway, that's what I think, and I just think it's going to take a lot. I think that we have been through a lot. Let us not underestimate that. I have, you know, I want to be very respectful, but I have a family member that almost died, okay? No matter what I said, they were being told, no, you can't be hospitalized till your temperature is 104 or more, okay? I had another family member that almost died from COVID. I was presumptive COVID. How we were treated as Black and brown people was absolutely disgusting. So at the one end, we were told, don't come in, okay? And we were dying. And now all of a sudden we have this vaccine and we want everybody to come in, and it doesn't quite go like that. It doesn't. So you are absolutely on point. Most of the kids I talk to, they don't know what Tuskegee is. They may say something about Tuskegee. They don't know what Tuskegee is. They are totally clueless, okay? They heard somebody talking about it. So anyway, I think I've talked enough.
I'd like to say that, Nikki, one of the things that is very wonderful about being young is that you think you're invincible.
That's right.
Don't know what illness is. You know it because your grandmother may be ill, but it really hasn't touched you that much if you're young. The other thing, there is a wonderful supply of arrogance when you're young, meaning that you think you know it all. And it's really based on, look, I got this attitude. But when you sit down and talk to them, as Dr. Tanya says, that one of the things that I found out is age is on my side. Like she just revealed she's 65, I'm 75. And what happened, because I'm 75 and I've suffered health-wise, I had the credibility with younger people that if you want to live to do things that I never thought at 75 that I still want to get up, get dressed, and act like I'm 25. And I am arrogant like that. Yes, I want to go, I want to do. But if you want to live to see not just tomorrow, but the future, your children, your grandchildren, and have all those wonderful, exciting times in life, you have to maintain a healthy attitude, not only physically, but emotionally and spiritually. And so some of our people are not understanding that there are great health disparities in America. There is no doubt about that. And the health disparities will definitely fatigue you along the way. But we don't have time for fatigue. We have a mission to accomplish. And Nikki, I thank you for your question because you've got a message to give. Every single one of you, do not be tired in well-doing. Because the fact that remains is you may reach 2 or 3 people. I never thought that I'd be reaching people all the way across the United States at this point in my life. And yet the fact of the matter is, you know, when you say when you're younger, well, God has a purpose and a plan for your life, that kind of goes over you. Yeah, right. Okay, great. Well, could you tell me what it is? Because I need some money. You know, or I need this man in my life, whatever it is. But the fact is, it's a little bit more complex than that. And that is the effect we have on each other, especially as people of color. There is a breakdown in communion with us as people of color. And that communion is done one by one. And it is time consuming. And the things that we used to have in my grandmother's generation, it's still there, but we've got to pick up that mantle and carry it on. So therefore, you get on that telephone, you get on that Zoom, you get on those social medias, and you rebut the people who are out there to take away the life of our Black people, whether it's Black people, purple people, green people who don't want us to survive, not just survive, but to live. We have to negate them. It doesn't mean that we'll know all the ways, all the things that they use, but you do have to know the facts that we are living because of a vaccine. Smallpox was horrible for America. Tuberculosis was horrible for America. And we took those vaccines. And we're here to testify to it. Tuskegee never should have happened, and all the rest that happened to us should never have happened. But we're out there in the forefront. So I really do want to encourage you as a younger generation. I don't know what's going to happen in the next 20 years, but my faith is in you. My faith is in you, Nikki, and in Nicole, to know that you're carrying I guarantee you're going to carry that message, not just about the vaccine, but encouraging people to see beyond the perspective of the now, to know that there's a future.
Thank you both for that.
Yeah.
Does anyone else have any questions?
Dr. Tanya, can you talk a little bit about the fear of women, particularly young women that are in childbearing age that don't want to take the vaccine? Because that is such another big group of people, and young African-American women I hear. And matter of fact, I know I have a friend that she's really trying to get pregnant and she's not taking the vaccine. And so I even called her today. I was like, well, and I couched it in this way, like, well, have you talked to a medical professional about this? Have you been on a town hall? Because we've got a town hall about this. And so she said yes, and I'm not taking it right now. And they told me she said the doctor said to her, just go take a test, just keep getting tested regularly. But it just seems to me, and I am not of childbearing age, but it just seems risky. That time has passed, but it just seemed risky. And they're taking their life in their hands, the lives of their potential child and their family members and others.
Yeah. So let's talk about that. And it's funny. I'm doing a webinar next week, and I based it on that old song, Let's Talk About Sex, when we were talking about HIV and protecting people, from HIV. Let's talk about COVID. And I say that because I think there's a duality there. The young women, and I'm looking at Nikki right now. She can't tell I'm looking at her, but I'm looking at her. The young women are worried about the impact on their pregnancy, potential pregnancy. And the young men are worried about being sterile. Mm-hmm. Okay, we got that going on, right? So here's the deal. I think that young women who are trying to get pregnant, I find it very fascinating because many young women have no idea when they're pregnant. And that's why so many, I'm looking at Reverend Nurse now, that's why there were so many pregnant women in the trial that we didn't expect to be there. We didn't expect to be there, right? And I think one of the things we have to do with women is we have to listen to them, because so often we're not listened to, right? And there's a campaign right now. And it's so funny, sometimes when administrations change, under the guise of not wanting to continue something, there's usually something good, right? Like a broken clock is right twice. And there was a campaign called Hear Her, okay? You may still be able to see it through the CDC. And it's basically about different women talking about problems they had in pregnancy, and people didn't hear them. And it was done in English, it was done in Spanish, it was done in all sorts of languages. And I say that because we have to hear what they're saying. They're very frightened that they're going to take a vaccine, and they're really frightened they're going to hurt their baby. And I think that we have to do the multiple touches so that they hear it multiple times. I have a slew of goddaughters, right? So I can't tell you how many times I had to talk to them before they got their vaccine, but they finally got their vaccines. And I think we have to talk to them about the American College of Obstetrics and Gynecology. They like to use this. Tell them, go to ACOG, American College of Obstetrics and Gynecology, the COVID-19, and they have a wonderful webpage that they update all the time. They have specific information there for young ladies. I think we have to listen to them, but also talk to them. We have to say to them, listen, particularly if they're Black and brown, you know, we have a higher rate of maternal mortality, right? You know, we have a higher rate of maternal morbidity. And if they don't know what morbidity means, we have to explain to them what it is. And that's all good, okay? So, you know, because of your beautiful brown, Black skin, or your Latina, you know, whatever it is, okay, that you're at higher risk, okay? Now, COVID-19 is like putting another risk, okay? And because you are Black, because you are, you know, Latina, okay, you have just closed the door by not getting the vaccine to be able to decrease one of those risk factors. Don't you want to do what's best for your baby? If you want to do what's best for your baby, you need to protect yourself. So I think we have to we have to listen, but we also have to step back and be truthful with them and say, listen, have you read about all these mommies, you know, all these mommies that died, you know, who had COVID and what happened to their little babies? And they're going to look at you and say, no, I didn't think that was a problem. And they are right, because you know what? We told them over and over and over and over again about the old people. We didn't spend as much time during the peak of COVID talking about all the women who either died or almost died in childbirth, coming in perfectly healthy, no temperature, no nothing. Something about the process of childbirth, they went from 0 to 360. So I think as women, and women of all different ages and all different views, and all of our, you know, on our social media, we need to get that message out. We need to get them to talk about their fears and how to, you know, and in our talking about how to prepare their bodies for pregnancy, for a healthy pregnancy, put it in that format, that this is a way that your body, I'm looking at the Rev now, okay, and you of course too, that our bodies are our temples, and one of the ways that we protect our temple is, you know, through this. Many of the young women, and I'm sorry, I'll stop, but you know, I love young women. I have a thing about pregnant mommies and babies. That's my thing, right? And so I think that we have to be willing to go back and back and back to them, you know, because overcoming fear is hard, you know. I think they have to see more people, you know. I think they need to be able, you see, like Reverend Nurse talked about getting the vaccine. I think we need more people like her. And I think we also need to have people who didn't get vaccinated, who were in the hospital. We need mommies who made it. They made it to the other side, right? They didn't die. We need those mommies to talk, right? So they can hear them. Okay. We need those mommies to talk about what happened to their little baby. You know, we need Dr. Debbie here, by the way, but we need them to talk about what happened to their baby because they didn't get the vaccine. And not to scare them, but we need to, like, you know, take different approaches. We need to be like seriously on social media talking about this because I think it's only by talking and listening and, you know, going through this stuff over and over again with trusted people, like Reverend Nurse said, you know, that they're going to change their mind, and we can never give up. We can never give up, because you never know. It could be Nikki one day. It could be Katie. I'm looking at all your names. It could be Lisa. It could be Erica. It could be Yolanda. It could be Laura. It could be any of us. Yeah. And all of a sudden it clicks. And we have to talk to their partner, because their partner or partners, that's a whole nother discussion, may be telling them, don't get vaccinated. So that's what I think.
Thank you. Thank you.
Barbara, I wanted to mention that my sister and I, a while back, we did an interview on Channel 16, but I have the footage, but it's my sister talking about how she came to the decision to get the vaccine while she was pregnant. And it was not an easy decision at all.
Mm-hmm.
But she talks about how she came to that decision and how she felt a weight lifted off of her shoulder after she got it.
Good.
And she, when she was pregnant and she was really, you know, she didn't know if she wanted to do it, but she had realized that she went from being this healthy person that had, you know, a little risk factor for being pregnant. Well, no, she went from being this healthy person to all of a sudden, now she's at risk, you know.
Oh, wow.
She had no risk. Now all of a sudden she's at risk, and her baby. So that was one of the reasons, but it was a lot more, you know, mental, you know, thinking and going back and forth of how she got to the point to get the vaccine. And she's fine. She's had her baby. The baby's 3 months now.
Okay.
Big and healthy and fat, and she's healthy. So yeah.
So we probably need to get her, Nicole.
Definitely.
Yep.
Definitely.
Yeah.
Her
name's Ivory. Yeah.
Thank you. Thank you.
So I know we're a few minutes over. This is such great discussion. I do just want to do a last call just to see if there's one more quick question or reflection that anyone wanted to share before we wrap up. All right. So with that, first want to thank you all again for joining us this evening. Thank you so much, Reverend Nurse and Dr. Raggio-Ashley. We went through a lot of great information today. We understand that you may have some additional questions. So if you'd like to, receive the recording of this session, if you did not RSVP, if you just pop your email in the chat, you can direct message it to me as well if you'd like, be able to follow up with that with you. And also the wonderful Laura Gonzalez, who is also on this session today. She, along with her colleagues at Neighborhood Health, have updated FAQs for the COVID vaccine, so we'll be able to share that with you as well. And then I'm going to share my screen one more time, because I do want to make sure we highlight some upcoming vaccine clinics and locations available in the Mount Vernon community. So again, via email. If you RSVP'd, I'll be sending this automatically, but please let me know if you'd like to make sure you can get this information. But there are clinic locations all across the Mount Vernon area that at this time are all walk-up appointments, no appointment needed. And one highlight is also, since Nikki is on the line today, that we do have a very special one-time vaccine clinic at Creekside Village Apartments on Monday. That's a one-time event, but all of the other locations are regular locations that you can go and get your COVID vaccine. We did also want to highlight coordinated service planning, which connects Fairfax County residents to county and community-based services and resources that promote self-sufficiency and enhance well-being. The CSP builds community member strengths to address immediate and long-term needs as a result of the coronavirus pandemic. So if you need any if you have any questions or need any support, please call the CSP at 703-222-0880. And with that, that wraps us up. Thank you all so much again for joining us this evening. And if you do have any follow-up questions, please send me an email. I can pop my email in the chat. And with that, have a wonderful, wonderful evening.
Thank you.
And thank you again, panelists. Appreciate you.
Yes, Dr. Raggio and Reverend Nurse, thank you very, very much. You both did a fantastic job.